New data shows that an experimental Alzheimer's drug modestly slowed the brain disease's inevitable worsening. Japanese drug maker Eisai and its U.S. partner Biogen have said that lecanemab appears to work, and they've released their study's full results this week. Eisai says the drug's benefit translates to about a 5-month delay in progression over the 18-month study. The U.S. Food and Drug Administration is expected to decide whether to approve the drug by early January. Well, this comes as hopeful news to the millions of people worldwide suffering from the fatal disease. Joining us now to give us the latest information on the scope of the disease in Canada is Dr. Joshua Armstrong, research scientist with the Alzheimer Society of Canada. Dr. Armstrong, welcome to Forum Daily.
Thank you.
So, what do we know so far about lecanemab, how it works, and what this means to the Alzheimer Society of Canada?
This is a relatively new drug. It's a monoclonal antibody. It's been developed to try to address Alzheimer's disease in people who have either mild cognitive impairment or early stages of the dementia. What it happens is it happens to bind to proteins in the brain that come along with Alzheimer's disease called amyloid and help the immune system take them out of the brain to hopefully improve the brain health and cognitive function of these older adults.
That sounds quite interesting, Dr. Armstrong. So, how is the Alzheimer Society of Canada reacting to this development?
It's somewhat exciting news to see a drug have some positive outcomes in a trial. We've seen failure after failure looking at drugs to treat Alzheimer's disease. To see a positive sign or some signal that there is possibility of addressing this condition is a good thing to see.
Promising to see as well, indeed, sir. Now, in terms of current treatments available in Canada for those with Alzheimer's disease and other forms of dementia, what do we know so far about that?
There are no current treatments that actually can address the progression of Alzheimer's disease. There are some drugs that might treat some symptoms, but nothing slows down the progression. So having this new drug, having some sign that it may slow down some of the progression is a positive sign.
It is a positive sign indeed, sir. Now, I want to jump to a recent study by the Alzheimer Society of Canada. It actually recommends actions that the Canadian government can take to reduce the risk of the disease developing in the country. So tell us a little bit more about the study and what realistic steps our officials can take about this disease.
Sure, this is the landmark study. We published the first report back in September, looking at projections of dementia in Canada over the next 30 years. So one of the things that the report found was if we were able to delay onset of dementia, we were actually to be able to avoid many, many people developing dementia in their lifetime in Canada. The idea would be if we could improve dementia risk reduction in Canada across the population, delaying the onset, would then be able to avoid dementia at a fairly high rate. This can be done through many things, mostly through addressing what are called modifiable risk factors, things that increase the risks of the disease in the population. We're able to better address those. We might be able to reduce the numbers of dementia that we see in Canada.
And how big of an impact would this make on the disease in Canada in terms of stats, in terms of kind of data that we have, if Canada were to implement these steps?
Well, there's a whole range of steps. So if we were able to delay the onset by just 1 year, we'd see a drop in almost 400,000 cases across Canada over the next 30 years. A 5-year delay in onset, we see that number increase even more drastically. And if we could push off the onset of dementia in 10 years effectively across the whole population, we'd almost avoid over 4 million people developing dementia over the 30-year time period. These are very optimistic, and the idea is to be effective across the whole population. But if we could have a wide-scale interventions where we could address brain health, address these modifiable risk factors, we could have a great impact across the country.
Some promising information there, doctor. It looks like we've got about a minute left here. But in terms of the scope of the disease in Canada, what do we know so far about it? We mentioned worldwide information. At least 50 million people around the world, according to the UN, have this disease. But what about in Canada itself?
Currently, we're looking at about 660,000 people in Canada with dementia, with that number expected to increase fairly rapidly over the next 30 years due to the aging of the population. Baby boomers are getting in their late 70s, 80s, and 90s. And with age comes a greater risk of dementia. So as our population ages, we'll see more and more numbers and more people affected by this brain condition.
We definitely need to see some action in this sector, Dr. Armstrong. Thank you again for joining us today on Forum Daily.
Thank you for having me.